Hello, I'm Kenneth Cutbush, an orthopaedic surgeon working in Brisbane. I'm a shoulder surgeon. I'm with Lucy Angelini, who's a shoulder physiotherapist. We're talking about Remplissage surgery. So this is you've got a shoulder that's unstable, and there are two situations I do a Remplissage. One is if you've got a labral tear at the front of the shoulder. You've had an anterior dislocation, the shoulder's come out, and you've torn the labrum at the front of the shoulder. It's then hit back against the front of the glenoid, and you've got a dent in the back of the humeral head, something we call a Hill-Sachs lesion. And in some cases, a labral repair at the front I would judge to be not quite enough, and I will add in a Remplissage at the back of the shoulder. So this is putting anchors into the back of the humeral head, into the Hill-Sachs lesion. The cartilage has been knocked off there, so it's just directly into bone. And we pull the posterior capsule into that Hill-Sachs lesion. It serves to tighten the shoulder up a little bit more and give a bit more stability to the shoulder. And a typical situation would be someone who hasn't taken a bone off the front of the glenoid but has a big labral tear and a big Hill-Sachs lesion in the back of the shoulder, and they're very sporty and very active, and I'll be wanting to give extra stability to the shoulder. And so it's a Remplissage. The other situation is someone who's had stabilization surgery. The situation that comes to mind is someone who's had a Latarjet procedure, and a very small percentage of patients, they're still a little bit unstable in the shoulder, not dislocating, but still feeling a little bit unstable. And a Remplissage to the back of the shoulder will give them just that little bit more stability that takes away that sense of instability in the shoulder. So that's what we're talking about. It's keyhole surgery. It really is always arthroscopic surgery. It's not something that's ever been really done open. And as I said, normally I'm adding it to a labral repair, but it can be done on its own. So you'll be in hospital one night, typically. We're talking about keyhole surgery, and the nurses the next morning will change your dressings. The physio will see you. You'll get out about 10 a.m. and they're going to be in a sling for 6 weeks. Full time, you can't drive. That post-op visit with the physio the next morning, take us through that, Lucy.
So we'll come and see you and teach you how to take the sling off and put it back on again by yourself, teach you how to put on a shirt, show you the best way to have a shower, and show you some gentle range of motion exercises for the shoulder that are passive, and then some active range of motion exercises for the adjacent joints, so making sure your hand and your elbow and your neck don't stiffen up as a result of being in a sling. And you'll normally see your physio then around 2 weeks post-op, just to make sure all the wounds have healed well, and to go over your exercises, make sure everything's going to plan. But yes, it's all very low-key to start with while we're letting everything heal.
So the first visit back is at 6 weeks. Take us through that.
Yeah, so that's exciting. You get to come out of the sling, which is good. And we get to start some range of motion exercises. Obviously, with the element of instability, we're not looking to push any stretching, but getting you functional range back early. And then as your range comes back, we can start a little bit of strengthening.
Yep. So the next visit then is at 12 weeks post-op.
Yep.
What do we do there?
So we video their range of motion just to make sure that that's appropriate, test for stability, and focus on their sort of return to sport or return to work goals. So getting them
they're starting to do some
running.
strengthening, aren't they?
Yeah, exactly. Yeah.
So when do they get to go to the gym?
So anytime after that 12 weeks, So they will have been doing some rehab, sort of strengthening exercises at home, and then they can go to the gym after that. We typically start, strengthening the back first, getting the rotator cuff, scapular stabilizers, and all your pulling muscles working really well, and then progressing to some pushing and then some lifting away from the body, and eventually lifting overhead.
And we see you back usually for a final visit at 6 months.
Yeah.
And that's normally about it, isn't it, in terms of the rehab?
Yes, they go quite well. Just checking for any signs of pain or instability.
And contact, of course, usually doesn't start till 9 months. Somewhere after that.
Yes.
So that's Remplissage, and that's the rehab. That's what you're looking forward to after that surgery. Thank you for listening.